to ensuring that we achieve.
The National Assembly Departmental Committee on Health has met with the State Department for Medical Services to scrutinize the 2025 budget policy statement. The allocation, however, is not enough.
Underfunding of the salary budget in the sagas, particularly in referral hospitals, coupled with the establishment of the new specialized hospitals, means that there is need to increase funding to employ and retain health workers. The recent challenges of the U.S. government funding require the government to intervene to sustain the provisions of the healthcare service in the country.
The ministry requires 426.8 billion for the financial year 2025-2026, but has only been allocated 172.6 billion Kenya shillings. The ministry is now calling for compliance with the Abuja Declaration, which calls for 15% of national budgets to go to the health, equivalent to Kenya's 630 billion of Kenya's 4.2 trillion Kenya shillings budget.
We therefore commit to utilize the resources for the provisions of quality health care services to the public. Lastly, Chair and honorable members, I thank this honorable committee for granting us the opportunity to present our priorities, budget estimates, and requests for additional funding. Supporting additional funding, I look forward to your continued cordial working relations.
The ministry also stated that it needed more funding for fully public funded primary health care for strategic commodities like HIV, drugs, family planning and vaccines, and to bridge declining donor support for blood transfusion.
The report that is being discussed is a report that our technical teams have reviewed and submitted an impact assessment report that the freezing or the suspension of funding by the U.S. government will impact our healthcare system.
As budget discussions continue, the big question remains, where will the money come from? Eunice Omolo, K24 TV, Nairobi.